Welcome to the Heart of Healthcare podcast. I'm Halle Tecco.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all. Hello, listeners, and welcome back to the Heart of Healthcare podcast. I'm your host, Halle Tecco. Today, I am chatting with Vinod Khosla, a visionary thought leader and investor in both the tech and healthcare worlds. Vinod started and runs Khosla Ventures, where he has invested in companies like Oscar Health, Sword Health, Guardant, Headspace, OpenAI, 8 Sleep, and many, many more. When we were starting Rock Health back in the day, a lot of folks wrote us off, but Vinod was an early supporter. Vinod, you believed in our vision for a better healthcare future, and I'm so grateful that you believed in us back then. So thank you, and thank you for being here today.
Well, it's great to be here.
In 2012, around the time we were starting Rock Health, you made the prediction that AI could replace 80% of what doctors do. Do you still believe that?
Absolutely. And I would say 80% of what doctors do and 100% of beyond what doctors can do today is what I would claim. But about right after our conversation back in 2012 or so, and just before that, I'd written a blog called Do We Need Doctors in TechCrunch. It became clear to me, and I wrote a 100-page document on the transformation in medicine, which I defined as 8 different 3-year cycles. So about a 25-year plan on how that transformation would happen. It's pretty clear to me today that we are on that timeline and maybe going a little faster in terms of capability to do these things. What's hard to predict is how the system will react, how the system will adapt these technologies and respond to it. So, your regulation can slow it down. Lots of things can slow these things down, but we are well on the path to the technical capability.
I'm sure you saw recently the Kaiser nurses protesting AI in San Francisco. This entire industry has long been very resistant to change. And if you look at 9 of the 10 highest compensated occupations in the country, they're medical. How can we break through this guard of folks who are very resistant to change?
Yeah. I think we have to realize that when we talk about the kinds of disruption we talk about in the technology world, there's somebody on the disrupted side who will fight back and protect their self-interest. So self-interest, as we know, is a powerful force, and we can't ignore it. We have to be considerate. For example, I've had a number of conversations with the president of the American Medical Association on how we might change billing codes. So a physician could do more of what they want to do and less of what they don't want to do by adapting AI. They could have much more frequent contact with the patient and still double their patient panel with the help of AI. So in a fee-for-service world, you could, in fact, double the patient panel of any physician, and they'd be quite happy with that, and they'd get the ability to much more closely connect with their patient. I don't think with AI it's unreasonable to say the phrase I use is 100 touch points every 100 days with a patient, say with a chronic disease. That becomes feasible. And if we set the billing system up that the oversight of the physician on the AI system gets them paid the same way, and maybe they can even double their patient panel. We can stop talking about primary care physician shortages or other physician shortages It's much worse worldwide. We'd have a constructive way of protecting their interests and introducing AI in a way that's much better for the patient, hopefully even lead to reduced costs.
And what I'm hearing is that AI is not going to make the profession obsolete, but rather free them up to do the most important work and take over the lower value work, or augment kind of the more the administrative work.
I don't separate it by lower value or higher value. For example, if you look at the transcriptome of a human body, you take a blood sample, do a transcriptome, you get millions of data points. That's not lower value work. It's not work that humans can do very well. If you really fine-tuned monitoring the health of a patient, that transcriptome and its interpretation is very important. And AI could do that in a way that's complementary. All I'm saying is, at least for the next decade, and it's been 10 years or so since, a little more than 10 years since my forecast, for the next decade or so, humans will be overseeing it. And if we change billing codes, then they will be comfortable that their income won't be affected, and they will provide better care to patients. Most people who went into medicine because they want to provide better care. And if AI can help them do that, for example, earlier this year, I fractured my hip and had to have surgery. I was up in Utah skiing and fractured my hip. I didn't get a single call back after 4 days in the hospital after I left. Wow. That's pretty poor follow-up, and that could have easily been done by an AI.
Yep.
And escalated me to the right person in the hospital system if, in fact, further follow-up was warranted. That should be routine, and it's a good example of where you can provide much more follow-on care.
Yeah.
When I had a question, it was hard to find somebody. Now, of course, I'm lucky enough to have a network here in the Bay Area. I could call people here, but that's the wrong way to do things. Every person, normal person, should have access to follow-up questions, all that, and follow-up visits, but only if warranted.
The technology to follow up with a patient automatically, I mean, that has existed for decades.
Yeah. I do think much more sophisticated follow-up is possible. For example, an AI could do drug titration. Is the dosage not working for you or for something?
Yeah.
Or is your compliance lacking because you don't like the side effects and so we should change dosage? Or it's not making a difference and we should change drugs? So there's lots of things there where beyond scripted follow-up, AI can do a lot more sophisticated things like drug titration.
So when we think about huge technology shifts in healthcare, can't help but think about the EHR and how over the last 2 decades it's gone to ubiquity. But I'm sure you also have doctor friends who just complain about the added work that the EHR has created for them and the documentation. And so I feel like that's really added to the poor relationship a lot of providers have with technology and a lot of the resistance they have for new things, because maybe there's some fear that new things, including AI, will actually add to their workload versus the opposite.
And I think it rests on us in the technology field to prove that's not the case. I heard an amazing statistic that the typical ED doctor in an emergency room all day has 2,000 mouse clicks into their medical record system.
Wow.
That's, to me, stunning, if the statistic is true. But we have a beautiful startup that will ensure no physician. And they spend about 20 to 30% of their time dealing with the medical record system, not with the patient. But the startup actually lets the physician talk to them as if a junior intern was there, that AI, that then does all the entry. So all they do is voice conversations with this Imagine AI agent. which then
scribe.
does all the entry and extraction of information from the Epic system, for example. So you never have to learn how to use Epic. And that's a great example of almost all systems. Humans in the past have had to learn computers, learn how to use Epic, how to place an order, how to look for certain information, how to make a certain note. I think one of the big advantages of AI will be computers will learn humans instead of humans needing to learn computers. And humans will just talk in natural language, whether it's to program a whole new program, create a website, enter something into Epic, extract something from Epic. It'll be a conversation like a normal human would have, as if they had an assistant there doing their bidding.
Yeah. When you're investing in this space, how do you look at a company and balance between something that you're excited for technologically, and this could actually benefit healthcare, versus is healthcare ready? Because there are a lot of things that exist today, but maybe wouldn't get widespread adoption, wouldn't get reimbursed.
And you bring up an important point. There's multiple things one can do with AI in healthcare. And I'm not going to go into AI will be phenomenal in drug discovery. I've talked about it for a long time. And with the ability of AI to go into predicting protein folding and other kinds of genomic effects, let's not go there for a moment. Let's just talk about the everyday practice of medicine, which is patient interaction. AI can do an intake of a patient that's phenomenal. 95% of the time, physician doesn't have to do a lot more work or follow-up, and they can do the function they are likely going to be required to do the next decade or so, which is say, is the recommendation for a diagnosis the right one? Can I give it to the patient because the AI is not FDA authorized to give a diagnosis or a prescription to a patient? But they can look at it. They can make adjustments. They can ask a patient additional questions if the AI missed, which is good for the AI because it helps train the AI. But it's great for the physician. Make sure there's no missed diagnosis, for example. I think the amount of misdiagnosis will decline. But the physician is overseeing the AI in intaking a patient and the diagnostic and prescription recommendations, for example. I'm very excited if you can replace and augment the expertise. So whether it's primary care, which we should have 10 times more of than we have capacity for today.
Yes.
And AI can complement a physician in that. Or it's, say, a tumor board if you're unfortunate enough to get cancer. Most people will never get a tumor board. And we should, at that extreme, have AI expertise doing that function, probably as well as the best tumor board you could get at Memorial Sloan Kettering with a few years of the focus and development. We're not there today, but probably easily possible to get there. So replicating expertise is really exciting to me, and I spend a lot of time on. We have phenomenal physical therapy in SWORD. In fact, after my hip fracture, after I tried humans, it became the most consistent thing I could do, is have an AI do my physical therapy with me. Same thing with cardiac diagnosis with the LiveCore, or coaching with the Hello Heart for hypertension. So a lot of these are very, very effective, both very successful digital health companies, but also very effective for the patient, very cost-effective for the payer. There's the other side of AI, claims administrative side. And we spend way too much of our money in our healthcare system on the administrative side. Claims processing, reframing claims so they'll be reimbursed, and on the payer side, trying to fight AI that fights the claims. I'm less interested in that personally. The administrative side is definitely an area where you can do spy versus spy kind of a battle between the payer and the provider. But that's less interesting to me. I think that's partly engineered to be the way it is, not something that's an easily solvable problem even without AI. But there is AI to be applied on the claim side too, or the administrative side. Scheduling is another example, matching a patient to a doctor for the kinds of conditions. But let me give you a phenomenal example that I love. Huge shortage of mental health therapist capacity in every part of the world.
Yep.
We have a company called Limbic that is now in 40% of all NHS mental health clinics. And the NHS requires the clinics to do an intake interview before they accept a patient. Our AI can now do that interview and is doing it every day in 40% of these clinics. And here are the results of a study of just over 100,000 intake sessions. 100,000. How many therapy or psychiatry or psychology studies have you seen that have that kind of volume?
Not many.
The diagnostic accuracy for the top 8 talk therapies was 93%. And they could directly refer a patient to the right specialist instead of taking a long path to finding the specialist that's the right therapist for them. By the way, diversity and inclusion improved dramatically, like 25 to 30%. And for the most marginalized communities, like transgender, it improved by 150% because the AI did not discriminate. So a couple of examples.
We'll be right back after the break. This season, Instacart has your back to school. As in, they've got your back to school lunch favorites, like snack packs and fresh fruit. And they've got your back to school supplies, like backpacks, binders, and pencils. And they've got your back when your kid casually tells you they have a huge school project due tomorrow. Let's face it, we were all that kid. So first call your parents to say I'm sorry, and then download the Instacart app to get delivery in as fast as 30 minutes all school year long. Get a $0 delivery fee for your first 3 orders while supplies last. Minimum $10 per order. Additional terms apply.
Let's use that example. For instance, when you were meeting with this team early on and thinking about it, the technology was obvious to you that it could make a big difference even before they had this data and this research. But how did you decipher or how did you predict that the NHS would adopt the technology, that providers would use it? Because I just see a lot of things that are really cool, but don't get traction because the system isn't ready for it because it's so slow to adopt new technologies.
We have to balance our portfolio. If we take the approach that something has to be accepted before we invest, we're never going to be innovative. Innovation necessarily means doing something that isn't accepted today, that dramatically changes the cost curve, the care curve, the level of care you can provide a patient. So our job is to take those risks and then help the entrepreneurs find clever strategies. So if you say we are really developing not an intake AI, we are developing, whether it's in Cura, which is doing primary care, or Limbic, that's doing mental health therapy, they're all doing intake, but the goal is primary care or therapy. And we then, as investors, and I hate to call myself an investor, as an assistant to the venture, help them get these technologies adapted in the right way or frame it the right way. And sometimes it's just hard. And sometimes you have to do the hard work.
Yeah.
For example, I've often tempted with the idea of starting an insurance company that's digital first in everything, and everybody signing up does digital first. Almost certainly the cost of such an insurer will be a lot lower. And you could take my example. If I hurt my knee, I can decide to do surgery or I can do physical therapy to avoid surgery. The patient would be better off, the payer would be better off, but if I'm a surgeon, I'm not better off. If I'm guiding the patient on what's best for them, I'd probably recommend therapy first, and the patient would prefer that over surgery.
Oh, for
and
sure.
one can guide people to the lowest cost, most effective treatment, not the one that's incented by income.
Yeah.
Clearly, there's way more surgeries in musculoskeletal in the US than most systems. Why? Because we've set up the compensation incentives that way. And there's better ways to do things, and AI can help point that right path. And us as investors can help the people developing these technologies pick the right entry points, the right path. Path dependence matters a lot.
Yeah. The insurance company is an interesting example because one of the biggest challenges is that most of us are insured through our employer, and therefore we have little choice. Maybe we have 3 options within a single insurer, but we kind of don't have that consumerism within health insurance. And so we're kind of stuck with who's in network and which kind of coverage we have. Is that something that you ever think about, like a future where we're kind of decoupling insurance from employment?
There's ICHRA plans coming into vogue where a budget everybody gets a budget as an employee.
Yep.
And they get to spend it as they want. I'm excited about that idea. So there's consumer choice. And there'll be more innovation in the plans themselves because consumer choice leads to more innovation in the plans people offer.
Yeah.
That's just one example. But employers are genuinely interested in reduced costs and good care for their employees so the employees stick around in the company. Now, those dual objectives can absolutely be achieved with AI. We've had poor attempts at that, like navigation companies, but that they don't do enough. And what we need to do is much more, and AI can do that. We need to do much more primary care, so downstream costs are avoided. Take this, the idea of this day and age. Most people who have cardiac disease discover they have cardiac disease by having a heart attack, which is a very expensive event for the payer, a horrible event for the patient, when the disease started 10, 20 years ago and could have been discovered and avoided. So it is in everybody's interest, except the heart surgeons, to have that heart disease be detected early and addressed through diet.
Yeah.
AliveCore is now authorized to diagnose 35 different conditions with their algorithms by the FDA to do things even a cardiologist would have a hard time doing. 35 conditions, including myocardial infarction. So heart attacks, AFib, bradycardia, you name it. Almost anything the cardiologist can do just from a simple device. Now, the first preliminary approval, approval requires, again, as it should, oversight by physicians. But we are on path to doing this all 35 conditions at home. And AI, in my other favorite example, AI self-driving for MRI machines, which Vista in our portfolio is doing, can reduce an hour and 15-minute cardiac MRI to 15 minutes.
Wow.
That then becomes feasible to do in an annual or biannual or every 5-year kind of cardiac exam. And you could detect most heart disease long before it progresses to catastrophic and expensive.
Yeah.
That's a really good example where self-driving technology, it's literally for MRI machines. There's no cardiac MRI technician needed. It's stunning what you can do.
I'm sure you saw your portfolio company, OpenAI, and Arianna Huffington's company, Thrive Health, announce Thrive AI healthcare this week. I'm curious your thoughts on that, because they're really going after behavior change and helping people build better habits so that they can live a healthier life. Behavior change has been historically a really hard nut to crack.
Wellness, which Arianna does well, is an area that's not been affordable. If you had to hire registered dietitians for every interaction, and you wanted to have really frequent interaction, that's really hard. So wellness has not been affordable, especially since the insured patient may not be with your insurance plan next year, so you're investing in something somebody else may get the benefit of. So those become affordable. In fact, there's a great company that started in India called Healthify, and they have a service where they have a nutritionist with an AI and an AI only. And of course, the AI only service costs 70% less, but you can get nutrition guidance every day, and people are using it for every meal. It's just being introduced into the US. It'll be a pretty exciting service to see where AI does 80%, 90% of the work. And when you want nutritionist oversight, you can get that. It's a classic example of wellness that couldn't be affordable, supplements advice that couldn't be affordable, nutrition, food advice that couldn't be affordable, now being affordable because AI enables it. And Mark Hyman is right in food is the best medicine. Mark Hyman is wrong in having one prescription for all 7 or 8 billion people on the planet. It's very hand-wavy today, food as medicine. But if you can get precise with food and medicine, as if you had your own functional medicine physician to guide you sitting on your shoulder, that's the right way to do it and be effective. So very exciting opportunities in wellness too.
But we're still up against systemic issues like food costs and food shortages. And, we can maybe solve for the education piece, but not some of the other issues within our food and health system that puts certain people at higher risk.
Look, we can't solve every problem with AI. Maybe in 25, 50 years, we will have so much great abundance. And I did a TED talk on that in April. And one would be very excited about the abundance and everything would become affordable. But I do think AI can rapidly improve the situation for people and rapidly decrease inequities in the system. Will it make food more affordable? Marginally, not significantly, because that's a whole different process. Now, we are applying AI and robotics to food to make it cheaper and better. But I do think, in the end, fresh food goes against the mass food system of frozen and marketed and salt and sugar added to tempt you. But the thing that can help, I referred earlier to 100 touch points in 100 days. If your primary care physician could talk to you every day in a very unobtrusive kind of way, a little text message, a nudge here, behavior can most be changed with nudging. It's a powerful tool. It makes that affordable.
Yeah.
And, in the parlance of AI, there's no cost difference between a primary care physician calling you and nudging you, or their AI calling you and nudging you, a nurse nudging you, or a nutritionist nudging you or just a coach or an everyday person, your mom nudging you. It's the same thing. The expertise can be in everybody.
Is there anything that worries you about this future? For instance, reading about the AI drones that they're building in Ukraine. There are things that sometimes worry me about how fast this is evolving. Do you have any worries, or do you feel like we can kind of build guardrails for AI?
Well, we can definitely build guardrails. So when Cura is talking about primary care in medicine and using it for everything from chronic disease management, coaching, gaps in care like vaccines, nutrition, food, supplements, advice, the biggest problem isn't the AI to do it. And ChatGPT does a pretty good job. It's the guardrails. Yeah, you build the safety systems, the oversight systems you build. So absolutely guardrails are needed. And regulation isn't a bad thing there. What I would say is the rate at which it's happening makes it harder for humans to adjust and adapt. And there's always lots of great great effects of technology, but also side effects or unanticipated effects. And we have to worry about them. We have to be extra vigilant. It becomes harder when the rate of change is high. And so we have to be extra vigilant with this iteration of technology, looking for side effects, looking for unintended consequences. Those almost always are there. Biotechnology is great, but biowarfare is horrible.
Terrifying.
In fact, frankly, with AI, the thing I worry about is bioterrorism more than anything. So we do have to be careful and cautious.
Yeah. I mean, we can regulate all we want here, but we can't stop other people around the world from using these tools for not good reasons.
No, Ted Bundy could be using these tools.
Sure.
He was a mathematician. I'm sure he would have understood the technology and have access to it.
Yeah. Switching gears just a little bit, but just thinking about how the future could unfold, what advice are you giving young people these days on what they should be reading and what they should be studying to make sure that they're ready for the future?
Well, there's probably two phases. There's the next 20 years and beyond the next 20 years. The next 20 years, I would say, what jobs are valuable and what are not valuable is very hard to predict and will shift rapidly. And I think we will be in an era, what I tell kids entering college is be as diverse in your education. Don't learn a particular subject. Learn to learn a subject and establish a broad basis. So if you're doing computer science, also do neuroscience, also do linguistics, for example. Teaches you certain style of reasoning, for example. So the broader the education that builds a platform for any future learning is what I recommend. And, in my own case, very little of what I learned today, whether it's trying to learn about cell therapy or protein folding or AI, has to do with what I had learned in college. But I did have a strong enough basis in math, in physics, in chemistry, even in biology, being a biomedical engineer, to be able to learn any new areas. And that advice is much more relevant today than it was for my generation, where you could pick a career and stick with it for 30 years.
Yeah.
So the next 20 years, I'd say breadth matters, and my recommendation. Beyond the 20 years, I think the whole nature of the economic system, I think, will be dramatically changed. And my bet is 20 years from now, if you have a 6-year-old going into first grade, you would say, truly explore your interests. And it doesn't matter if it's surfing or X Games or music creation or others. This advice people used to give others pursue your passions, was generally bad advice. And I'd say pursue your passions as long as it pragmatically leads to supporting your family at the level you can support it. I think that second qualifier will go away 20 years from now. Probably not for this generation of 6-year-olds.
My 6-year-old will be excited to know that he can just continue to study Pokemon.
Well, there's a lot of learning to be had from games.
Yeah. I don't know if you remember this, but a few years back, I went back to school and got my master's in public health. And you said, why aren't you getting a nursing degree? That'll be more helpful. I'm curious kind of your thoughts on folks within healthcare. What are the places within healthcare that you would work or programs that you would study in if you really want to make a difference in the healthcare system?
So I don't remember this particular incident, but many more people will be able to go back to school. My wife went back to school at age 50 to get her master's in education.
Love that.
And I think that'll become much more common. So I do think most of the things we are talking about here will be done by an AI and well done by an AI. Mm-hmm. Incentive systems design, and we briefly referred to compensation. And there was a beautiful article in the Wall Street Journal yesterday on how the Medicare system is being abused, why certain specialty diagnoses have gone through the ceiling, or if you have a diagnosis and a drug for it, the number of years it continues is not consistent with the approvals of those drugs in terms of their curative power. So if in real world data shows 90% of the patients get cured, in provider data, 30 or 40% of the people get cured and the rest keep billing year after year after year. So these are abuses of the system, and I refer everybody to this Wall Street Journal article on July 10th.
I will put it in the show notes.
Look, incentive systems is what cause humans to behave the way they do. Unfortunately true. So I hope we can redesign the incentive systems around what technology makes possible. Value-based care was a great idea that became a silly idea because the only thing value-based care providers do is try and risk score patients up so they can bill the government more per patient. You know, when I talk to them and say, hey, let's increase the amount of primary care and reduce the patient burden and the cost of primary care and the cost of downstream diseases that can be detected early. You know, cancer is much more expensive detected late than early.
Yeah.
Diabetes can be detected early and managed through nutrition, but we wait till it needs to be managed with Ozempic. Same thing with cardiac disease. We can do that. They're not really interested. There's nobody interested even in a value-based system in that. They're interested in, can you use the same technology to find 2 more diseases this patient might have or that we can code for and risk score the patient up. That's unfortunate. And that's all about incentive systems. And we've set it up wrong.
Yeah.
In fact, me and my son were just talking last night after reading the Wall Street Journal article that really it should be an independent agency that risk scores patients, and then the providers get to actually manage their health. They don't get to risk score patients up on their own.
Okay. Looking at your healthcare portfolio, you have done exceptionally well in the diagnostic space. And I'm curious if you've had a thesis on this category and kind of how that's evolved over the last decade.
So diagnostics is generally not made money for people, but if you do it the right way, and I'll give you a couple of examples. I talked about cardiac MRI being done by a self-driving AI. If you reduce the cost of an MRI from an hour and 15 minutes of time in the machine, which is patients hate an hour and 15 inside that tube to 15 minutes. And you can do it much easier. Mass General has dramatically increased the throughput of its MRI machines, and they'll be able to offer cardiac MRI in remote locations where they couldn't because there was no cardiac MRI technician. Now, the economics there work, and the benefit to the patient is very clear. And many more patients are willing to do 15 minutes in the tube than an hour and 15. So you can diagnose early. A LiveCore can diagnose so many conditions at home that you can avoid a lot of pain. And so they have over 250,000 self-paying cardiac patients who are monitoring themselves closely, on average doing probably 6 ECGs a month, which you couldn't get out of a healthcare system. And when you get that kind of engagement, the data is pretty clear with independent studies. You avoid many more visits to emergency. You avoid the panic, but also the costs. If you're not monitoring, you'll have cardiac conditions that'll be really, really expensive. So those are just 2 examples. Yeah. But the same is true in so many other areas. I talked about mental health. I talked about primary care. We now have a company doing continuous blood pressure monitoring in Europe called Actia. So it likely will lead to avoiding strokes. If you're doing continuous blood pressure monitoring, you are likely, with enough data, be able to predict when a stroke is coming. Think about it and how debilitating a stroke can be and destructive of a person's life. If you could predict it and avoid it or take care early when it's less expensive. So across the board in diagnostics, the same can apply to genomics, genomic medicine. I love transcriptomics and proteomics as diagnostic areas. But you have to translate them into incentives for the right parties.
So final question is, you talk to a lot of founders, you've worked with a lot of founders in healthcare, you've seen a lot of ways that companies can go sideways. What advice do you have for healthcare founders who want to build something truly meaningful that can, stand the test of time and become quite impactful?
I start with not all hard things are valuable, but most valuable things are hard. And in areas that are really, really important to society, healthcare, education, climate, it takes a long time to do anything that's material. You can do surface stuff and occasionally get lucky and do important stuff quickly. Occasionally you can get a Snapchat or Snap, as it's not called. But mostly, they take time, they take persistence, they take solving a problem, finding its side effects, solving those side effects. It's just multiple generations of iteration. And so keep at it. Persistence becomes really important. Dedication to that mission becomes really important. The nice thing is, if you're really on a mission, it can be more financially rewarding over the long term. But it may take 10 years to build a great climate startup or a healthcare startup or an education startup. But in the end, you can not only make more money, but it's personally more rewarding, I find, to most people who are doing that.
Absolutely. I agree. Amen to that. Well, Vinod, thank you so much for all of your time today.
Great to be here.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Halle Tecco and Steve Krause. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and episode details.